Welcome to Health Vision. I'm Jackie Wolf, Associate Professor of Social Medicine at Ohio University. Every year, up to 40,000 babies are born in the U.S. with fetal alcohol syndrome. Dr. Peggy Proudfoot McGuire, the Instructor Coordinator of the Title IV Child Welfare University Partnership Program, is here today to talk with us about this major public health problem. Peggy, thanks. Thanks so much for being here.
Thank you for having me.
Why don't we start with a really basic question. What is fetal alcohol syndrome?
Basically, it's a constellation of anomalies that are seen in children who are prenatally exposed to alcohol. There are three criteria to be met to be diagnosed with fetal alcohol syndrome. That being that there are a constellation of facial features that are indicative of the fetal alcohol syndrome child. Usually they are born below the 25th percentile.
In weight?
In weight, yes.
So they're very small children. They have very distinctive facial features.
Absolutely. And they have central nervous system, excuse me, there are anomalies with the central nervous system, both physically and behaviorally, that are seen.
Are doctors so aware now of fetal alcohol syndrome that when a baby is born, would they recognize the facial features instantly and know that the child has fetal alcohol syndrome?
Not necessarily. I believe what they look for are the Apgar scores.
And we should explain what an Apgar score is.
Okay.
Apgar scores are done at birth.
Yes.
And within 1 minute of birth and within 5 minutes of birth.
Correct.
And
on a scale from 1 to 10.
Right. And it's usually done by the pediatrician that's in the delivery room?
Yes, usually.
And what are they looking for when they do the Apgar score?
Reaction times with the different physical reaction times with the babies.
Right, they're looking at babies' coloring, they're looking at their respiratory efforts.
Respiratory, very important.
Right, they're looking at muscle tone.
Yes.
I think there are 5 different categories.
There are.
And they give them a score from 0 to 2, each one of the categories.
And Apgar was a medical
She was an
doctor.
anesthesiologist. Virginia Apgar was an anesthesiologist who designed this in the 1950s.
Yes.
And doctors all over the world give Apgar scores the minute a baby is born now to judge fetal well-being.
They do, and they will be looking for the weight at that point in time.
So that can give them a suspicion then. If the Apgar score is very low, the baby might have central nervous system problems.
Absolutely. And also if they do have a medical history from the mother of a past history of drinking, which is usually not given because of the stigma attached to drinking in general, but let alone drinking while pregnant.
So even the obstetrician might not know that his patient has a drinking problem, that's a possibility. They might know they might not know the baby has been exposed to alcohol in utero.
This is correct. I know I worked in Alaska for years, and that's how I became interested in this topic. Alaska became known as having the world's largest population of fetal alcohol syndrome children in the world.
Really?
This was a...
do they know why that's so?
Well, it was a sample of convenience, actually. The subjects were under the auspices of Indian Health Services. So the mothers were able to be followed by Indian Health Services. They were able to be surveyed by them, their behaviors watched, and actually some of the babies that were born were reported by the obstetricians to the amniotic fluid smelled of alcohol when the babies were born.
And that tipped off the researchers.
Oh, yes.
Let's talk about the history of fetal alcohol syndrome a little bit, because this is, the term fetal alcohol syndrome was not coined until the early 1970s, is that right?
Correct.
And who coined it, and how did they even define this syndrome?
The first researcher to look into this was a French researcher named Lemon, who saw a continuity of these facial features and physical and behavioral issues with children. I think there were around maybe 10 or 12 children.
Did he even connect it with alcohol, or did he just see that similar behaviors had the children seemed to have similar facial features?
Yes. And that actually was the tip-off for him to begin the research.
Of what caused this?
Yes. And so he began the interviews with the mothers and started the research. Actually, in the United States, there were two researchers, Smith and Jones, which I always found very interesting.
Those are their real names.
Yeah, Smith and Jones actually looked into the same ideas that Lamone looked into.
So they had noticed the same cluster of features?
Yes, the cluster was there, and again, it was a sample of around 10 or 12 babies. So that also was early in the 1970s. Actually, I'm sorry.
Why wasn't this noticed earlier than the 1970s?
Well, it has been noticed earlier. Actually, as early as the 1600s, it was noticed in England when the tax was lifted, the gin tax was lifted in England. And gin was very available to everyone. So mothers were...
After they stopped taxing gin, you mean? It became more readily available to the population?
Right, it was cheap. And so mothers were buying this and, were becoming pregnant drinking this, and the medical doctors started noticing a significant change in behaviors and some of these features that we are seeing now in babies in the 1600s.
And they explicitly connected it with alcohol as early as 1600?
Absolutely. And they actually reinstated the gin tax.
For that reason?
The Medical Association in Great Britain reinstated the gin tax specifically based on that.
And yet it's so interesting how knowledge like that is lost over time.
Yes.
Because in the 1970s, it seemed like, oh my goodness, this is a brand new diagnosis. No one has ever seen this before.
Well, in biblical times, there are references in the Bible to not drinking alcohol while pregnant. So there are actually historical indicators that pregnant women should not take alcohol.
Now we should explain why alcohol is so dangerous. Alcohol is a substance known as a teratogen. Explain what a teratogen is.
Well, I call it a poison. As you were saying to me earlier, we had a brief discussion about that. It's something that affects the fetus in utero and the physical makeup.
It affects the growth of the fetus. It basically misshapes the fetus.
Absolutely.
It mishapes it can misshape organs. It affects the brain. Another very famous teratogen that people, especially who were adults in the 1960s, will remember is thalidomide, which caused limbs not to grow. Babies were born without legs. They were born without arms. They were born with misshaped ears.
Hands. The hands were the...
Claw hands.
Yes.
A very powerful teratogen. And alcohol, we all know is also one of the most powerful of teratogens, that it crosses the placenta. And explain about that. What does that mean when a substance crosses the placenta?
Well, in terms of drinking, whatever the mother's blood alcohol level is, the fetus will also experience the same blood alcohol level. And in rat studies or animal studies, it's been found that the cells that are making our bodies up, such as the glia cells and the Purkinje cells, instead of mitigating toward each other, which is a natural process.
I'm sorry, what are those cells? The cells that you just...
The cells, the Purkinje cells and the glia cells, those are the beginning cellular makeup of our brains, actually, and our bodies. And they mitigate toward each other in a natural progression. When alcohol or ethanol has been introduced into the cells, it's been found that they're either destroyed or they're pushed away from each other, and then they'll coagulate in a different way.
So it interrupts the progression, the normal development of those cells.
Growth and development is absolutely changed.
And it especially... alcohol can really act on the fetal brain.
Oh, yes.
And the growth of the fetal brain and the process of the growth of the fetal brain.
Well, during the entire gestational period, the brain is actually being developed. So when alcohol is taken in, and then depending on the metabolism of the mother, which will also, depend on their culture, their genetic makeup, and any synergistic effects of other medications or other drugs that they might be taking, that is going to have an effect because it's going to be introduced into the fetus.